Hi, I'm a nurse in the NICU and I'm going to show you how I verify the rights of an IV injectable drug. In this case, it's ampicillin. I've used Epic Playground to create a baby. This baby is 10 days old, 35 and 3/7 weeks gestation, admitted for respiratory distress syndrome. She is 2.9 kilos, has a single lumen centrally placed umbilical venous catheter, and she has TPN and lipids running. I'm going to navigate to the MAR. Ampicillin is ordered, and now we're going to walk through the rights of administration. Using the Children's Wisconsin policy, I created a checklist of the medication rights. Number 1 is to verify when the next dose is due. If the next dose is due in this 12-hour window, it will show in dark blue. In this case, it's 17:30. If you click below the medication boxes, you will open up more information. At the bottom of the window, you see the recent actions and the next actions due. Number 2 is to verify the route. In the expanded window, you see route listed right underneath the ampicillin's name. You also see intravenous at the top to the right there next to the administration dose. Number 3 is verify the dose of administration, including verification that the dosage is within the recommended guidelines for the patient's weight and age. The ampicillin order reads ampicillin 20 milligrams per ml, injection 146 milligrams, ordered dose 50 milligrams per kilo for a 2.9 kilo baby, admin dose 146 milligrams. So what I do next is verify that this dose is correct for this baby's weight by going to the references provided within the MAR. The two references that we use at Children's are Pediatric Lexicomp and the anti-infective dosing charts. For infants 28 days and less and under 2 kilos, the preferred reference is the NICU or the neonatal anti-infective table. So navigate to this table right from the MAR. Across the top of the chart is the weight and postnatal age. This infant is 10 days old and 2.9 kilos. It is also important to take note that this baby is not getting high dose ampicillin. This baby falls in the last column of this table. So this baby should be getting 50 milligrams per kilo Q6 hours. And this is exactly what the order reads, 50 milligrams per kilo Q6 hours. It's always a good idea to verify the math calculation by taking 50 milligrams times 2.9 kilos equals 145 milligrams. You have probably noticed that the MAR dose says 146 milligrams. If you click on the ampicillin hyperlink, you will get the product order report, and this explains why the dose was adjusted based on the dilution of the medication. I will explain this further when we get to talking about the dilution of the medication. Number 4 states, is this dose appropriate for this infant's age and weight? And we've determined that it is. Number 5 is verify the right volume / amount and show calculations. The volume of the medication is determined by the concentration of the medication. As you see above in the hyperlink there, it's 20 milligrams per ml. If you open this hyperlink, you will see the calculation based on the concentration of the medication. Here, Epic shows 145 milligrams divided by 20 milligrams equals 7.25 mLs. The dose then is rounded up to the nearest 0.1 ml to equal 7.3 mLs, which equals 146 milligrams. So we have determined that 146 milligrams equals 7.3 mLs volume. Number 6 is to check that the concentration is appropriate for the type of line with the use of your resources. Part of the responsibility of the administering provider is to verify that the IV injectable medication reference matches what the order says, which is what your MAR says. We will use this reference for the duration of administration in addition to the dilution of the medication. Back to number 6, checking that the concentration is correct. We know we have a UVC, which is central, so we're going to call that a CVL, and we're going to go to the second bullet there, and it says that dose is diluted to a concentration of 20 milligrams per ml by pharmacy, can be given via the CVL. Navigating back to the MAR, you see that our ampicillin is 20 milligrams per ml dilution. On to number 7, verifying the indication of use. It's important for the nurse and the bedside provider to know the rationale of why each medication is being used. Moving back to the MAR, the indications of use is listed in the middle there for sepsis, bacteremia, suspected or confirmed. It's important for the provider administering the medication to understand the indication of use. Number 8 is to verify allergies. This is found in Epic on the left side. This baby has no known allergies. Number 9, verify compatibility. I clicked on the compatibility chart, highlighted ampicillin, gonna scroll across, lipids is first, and you see that lipids, both types of lipids, are Y-site compatible with TPN. Now scrolling over to TPN, you see a star next to the compatibility for TPN and ampicillin, so now we have to navigate down to look at what the star means. The star says, please contact your team or satellite pharmacist in order to determine compatibility. We should first check our administration guidelines because the answer is usually on that. The guidelines state that CVL concentrations of 100 milligrams per ml are incompatible with TPN, and we know that our dose is 20 milligrams per ml, and that is a PIV concentration. It states here that the PIV concentration of 20 milligrams per ml is Y-site compatible with TPN. Number 10, check administration duration. Even though the MAR states it should be infused over 15 minutes, it is our responsibility to make sure that this is actually what our reference says. Returning to the administration guidelines, the duration of administration says to administer over 15 minutes via syringe pump. And then it says if the volume is too large or a patient is intolerant, then the medication may be given over 30 minutes via syringe pump. Steps 11 through 15 occur at the bedside. Number 11 is patient identification. Be sure to scan your medications prior to administration. After scanning your patient and the syringe, you're going to verify that the MAR is the same information that is on the syringe that you have in your hand. This includes the medication dose, volume, and concentration. You must also be sure to verify that the volume in the syringe matches what the label states. Then go ahead and enter the volume and accept in your MAR. Number 13 is to assure or verify that the medication is not expired, and you see that on the syringe. Number 14, verify the correct tubing at the time of the administration. So follow the tubing from where you would attach the medication syringe all the way down to where it attaches to the patient, so you know exactly where it's going into the patient's line. Number 15 is loading and programming the IV pump. Connect tubing using the appropriate aseptic technique, then load your syringe. You should verify that the syringe pump is programmed to the NICU profile. Find ampicillin in the NICU profile, then enter dose, concentration, volume, and verify the infant's weight. The pump will then verify the administration rate. This is in mLs per hour. It is important for the administration provider to verify that this rate is correct in mLs per hour. We know that the volume of this medication is 7.3 mLs. We also know that 15 minutes goes into 1 hour 4 times. We are then going to multiply 7.3 times 4. That equals 29.2 mLs per hour. This is then what the pump should be reading. It is now appropriate to start the infusion of this medication. The last step in administering this medication is to assure that the entire dose went in. This is done by following the medication with a flush. It is important for the provider to follow the correct steps in making sure that the rate is the same rate that the administration rate was when the flush goes in. So add your flush syringe using aseptic technique, enter restore, verify the medication and the rate of administration is the same as the rate the medication went in, and enter the volume to be infused. It is recommended to use 1 ml volume to assure that the entire medication gets to the patient.